Okay guys, internal rotation of the hip focus. We're gonna need some yoga blocks and a yoga mat. So let's get into it. Okay, let's warm up with hip cars. If you don't understand how to do this, please go into previous videos of how to do our hip cars. We can do this in different positions. Today we're gonna do this in a standing position. Again, breathe in, irradiate. Really important that we do that. We create full body tension. And then what we want to do is go into hip flexion. Come up as far as we can. Now we abduct. We kind of create the biggest circle possible. Then we come into internal rotation and we extend back as far as we can in extension and back into that neutral position. We don't want to be compensating through our spine. We just want to be working that focus joint, our hip joint. Then we come back, we extend, find our roadblock, then we external rotate. We fight for external rotation, going back down into that neutral position. Let's do this from the side. So breathe in and irradiate, come into flexion. We go abduction. Now we start to internally rotate, fight for internal rotation. Keep fighting for that internal rotation as we extend back, slow and controlled in the pain-free range. Neutral position, now we're coming back into extension, find our roadblock, then we go into external rotation, fight for external rotation, biggest circle possible, and come back down into that neutral position. Okay, let's do 4 reps on each side. So breathe in and irradiate. We're searching for the best possible movement, the movement that we have ownership over, and active motor control over. Slow and controlled, pain-free range. This gives us a baseline of our hip mobility and where we're at and what we need to work on. It also gives the nervous system information, gives nutrients to the joint, helps us maintain our range of motion, and helps us to have that active control in our outer range, opening up more mobility health. And last one. So going into our last one. Internally rotate, fight for internal rotation. And then we come up into extension, coming around. Fantastic. Okay, let's do the other side. 4 reps, breathe in and irradiate, coming up into hip flexion, abduction, internal rotate. Good. Extend, externally rotate, coming up. Try not to compensate with other parts of the body. Slow and controlled. Great, amazing. Okay, internal rotation base. Let's just go through some posterior and anterior pelvic tilt. So anterior pelvic tilt is going this way, posterior pelvic tilt. Anterior pelvic tilt, we're increasing the lumbar curve. Posterior pelvic tilt, we're decreasing the lumbar curve. So that's going to be really important, getting into our bases and getting the best line of tension. When I say, hey, go into anterior posterior pelvic tilt, For this one, for internal rotation, we're going to be going more into posterior pelvic tilt to get our tension. Now, depending on where you're at with your mobility health, we want to go into the 90-90 position. If you're really good, you might just use a yoga mat. You can increase the stretch by placing a block underneath your foot or ankle. But for those, we just want to find an area of tension that we can hold, that we're not compensating too much as well. So I'm just going to place these blocks here. I'm going to do 2 blocks for me today. These blocks are just going to help me stabilize myself. And I'll bring this one into a 90-90. This leg here, we don't have to worry about, just make sure that's comfortable. But we want our hip lined up with our knee and our knee lined up with our ankle here. Great, I can already feel the stretch. Now I'm going to bring my sternum around. I'm going to rotate towards the side that we're stretching, and then also posterior pelvic tilt. So as we posterior pelvic tilt and rotate, we find some line of tension. I'm going to use these blocks to help me get into that best stretch. Let's start our timer. Now we just relax, we do our breathing here. Find the line of tension and just try and relax into that stretch. So for this, you've just got to find the height that you need to go to where you can comfortably get into the stretch, making sure that you're not compensating through your spine or you're coming across like this and you're compensating through the hip and pelvis. Make sure that you can sit up straight and feel that tension through the hip. So let's go through our PAILs and RAILs cues. Our PAILs contraction is going to go into external rotation. We're going to hold our hand on our knee and we're going to be pushing up into this contraction. We're trying to drive our ankle down into the floor and we're rotating in external rotation. Try and focus on that rotational component of the contraction. Our RAILs contraction is going to be going to the opposite. We're trying to make your ankle lighter off the floor. So it's going to be this movement. And I'm going to place my hand on this side of my knee. I'm going to be pushing down into that and trying to make my ankle lighter off the floor. Hopefully that makes sense. But this contraction is going deep into the stretch. We're going into internal rotation. So I'm going to count you in for our first PAILs contraction. 15 seconds, best effort, but safe contraction. We're going to do that in 10 seconds. So we're going to place your hand onto your knee. I'm going to count you in 5, 4, 3, 2, 1. Pushing up into your hand and also driving that ankle down into the floor, building up that contraction to best effort. 3, 2, 1. Opposite contraction, trying to make the ankle lighter off the floor, placing your hand on this part of your knee and driving it down. Get that contraction. 3, 2, 1, and let's just go into that stretch. Now, that RAILs contraction can be really crampy. So if you feel like that, just gently go into that contraction. It's just the nervous system and your muscles haven't experienced contraction in this outer range. So they can be a bit sensitive there. Okay, so just relax into this. It's a 45-second stretch. "15 seconds to go for our second PAILs and RAILs contraction. Okay, I'm going to count you in for our PAILs. Remember, hand on your knee. 3, 2, 1, and contract. Pushing up into your hand, driving the ankle down into the floor, into external rotation, focusing on that rotational part of the contraction. 3, 2, 1, opposite contraction, trying to make the ankle lighter off the floor, placing your hand on the other side so we can just contract, building up that contraction to the best effort. And 3, 2, 1, and relax into that stretch again. 45 seconds. Feel that line of tension, do our breath work here. Okay, 3, 2, 1, just slowly come out of this base. What I want you to do is lean back a little bit so that you're able to contract and lift your foot off the floor. And we're going to do our lift-offs. So let's do 10 lift-offs. Last one, we're going to hold for 15 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and last one, 12. I did 12, not 10. Okay, keep that up. 15 seconds. Keep going, keep going. 5, 4, 3, 2, 1, and slowly release, coming out of that base and just recovery. Okay, let's go to our base on our other side, internal rotation. So I'm going to swapping over here, sitting on my blocks, getting into internal rotation. Okay, let's reset the timer. Good. So rotating the sternum, posterior pelvic tilt, find the line of tension wherever that is. Get into that stretch. Prop yourself up so you can sit up. Make sure you're not compensating too much through the spine, that we're just getting the stretch to the hip. And let's start our 2-minute stretch. Breath work here, 2 minutes. And I'll count you in for our PAILs and RAILs contractions. Try and make sure that this ankle is in line with the knee and the knee's in line with the hip. With the breath work, you want to inhale for about 4 seconds, exhale for about 8. So your exhalation should be twice as long as your inhalation, and that will help get you into that parasympathetic rest and digest. Because stretching can be quite sympathetic, it's a stressful thing. So, but you've got to earn your mobility health. So these functional range conditioning exercises, they're not easy to do. So you've got to really earn your mobility health. And we're stressing those tissues to get re-education, adaptation of the tissues. So that's how we do it. We want to get into that stretch for at least 2 minutes. Okay, we've got 30 seconds to go. PAILs contraction, we're going to hold onto this knee, going to be pushing up into my hand. We're going to be driving the ankle down into the floor. And we're going to be doing an external rotation contraction. Okay, I'm going to count you in 15 seconds. 10 seconds. 5, 4, 3, 2, 1, and drive that ankle down into the floor, external rotation, build up that contraction to best effort. Keep going, keep going. Really push as hard as you can. 3, 2, 1, opposite contraction. So we're going to place my hand this side of the knee. We're going to make this ankle lighter. It's going to be the hardest contraction. It's our rails contraction. Keep going, keep going. 3, 2, 1, and relax. Get into that stretch again. Bring your sternum around, rotating to that side. Posterior pelvic tilt. Find the line of tension. This is a 45-second stretch. Another 15 seconds, and I'll count you in for our PAILs and RAILs. Okay, 3, 2, 1, pushing up, driving the ankle down into the floor in external rotation. Keep going, keep going. 3, 2, 1, opposite contraction. Make your ankle lighter off the floor. Pushing as hard as we can. We're going into internal rotation, deeper into that stretch. 3, 2, 1, and relax. Relaxing into that stretch. Bring our sternum around, posterior pelvic tilt. And another 45-second stretch. Okay, 3, 2, 1, let's do our lift-offs. So to do our lift-offs, we just need to come back so that we're able to actually get a contraction to lift our foot or ankle off the floor. So I'm going to come forward into anterior pelvic tilt, and then we're going to go, that's the contraction. So we just want to be able to lift that ankle off the floor. Let's do 12. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and last one, 12. We're holding for 15 seconds. Keep going, keep going. Hold, keep holding. 5, 4, 3, 2, 1, and gently come out of that base. It's recovery. Great, if you've just started, decrease the intensity with regards to the stretch and the contraction. We want to build up the intensity over time so we can get re-education, adaptation of the tissues, and the best mobility gains. So now let's do our hip cars. All right, hip cars, let's get into on all fours. We breathe in and irradiate. We come into hip flexion. We then go into abduction and internal rotation, searching for the best possible range, searching out for the movement that we have ownership over for just our hip joint. We don't want to be moving other areas of our spine to get this movement. So we don't want to be compensating. We just want to be moving this hip joint. So slow and controlled, searching for that space, creating the biggest circle possible. Good, going to hip flexion. We then internally rotate, abduct, search for that space, fight for internal rotation and extension, then going back into that neutral position. We then extend back, find that roadblock, then we externally rotate. Fight for external rotation. What space do you have ownership over? That's what we're asking. Great, we want to do 4 reps on this side and 4 reps on the other side. Great, last rep, going into flexion, abduction, internal rotate. Fight for internal rotation as you're coming up. Try not to compensate through the back, go into extension, back into our neutral position. Into extension, find our roadblock. Now externally rotate that hip. Fight for external rotation, coming up into flexion and into our neutral position. Okay, so let's do our other side. 4 reps on this side as well. Great. Breathing in and irradiating, coming up into flexion. Abduction, internally rotate. Really search for that best possible space without compensating other areas of our body, especially our spine with this one. Great, just really slow and controlled. It's not how fast you do it. We just want to search for that space, get into that outer range. What movement do we have ownership over? Our CARS allows us to know it's the base or the foundational exercise for our hip. This is a representation of what the joint can do and gives us ideas of what we need to be working on and also our mobility health as well. Great, that's 4. Well done. Okay, capsular CARS, we want to lay on our back for this one. Bringing our leg up into that 90 degrees, our hip, and then we internally rotate and externally rotate. So just slow and controlled. Now we've opened up that space with the PAILs and RAILs contractions and stretch. We now just want to internally and externally rotate. Give our joint capsule and nervous systems that information about that space that we've just opened up. Okay, last rep. Really try and squeeze out as much internal and external rotation as we can. We go to the other side. Again, internally and external rotation. Okay, last rep, squeezing out that internal and external rotation. Great. So we want to see how we pull up after our PAILs and RAILs contractions and when we're in those bases. If you're pulling up a little bit sore, we know we just want to decrease the intensity with the depth of the stretch and the intensity of the contraction. But if you're feeling great, then we know that we can go that extra level of intensity, and we want to go best effort but safe contraction and safe intensity. So we just want to build this up over time. We want to get re-education, adaptation of those tissues. We want to get active control and better mobility. So let's give it a go.